sponsored by the Association of Community Cancer Centers, ACCC, called the Institute of Clinical Immuno-Oncology, or ICLIO. One of the most exciting things going on in cancer today, and is evidenced by the session at ASCO this year, is immuno-oncology. And we have many new drugs, and we have to get these drugs to our patients with immunity. ACCC represents over 20,000 members and treats over 60% of the cancer patients in this country. And we want to make sure that every patient who is eligible for immuno-oncology, as it broadens and expands the new indications, has access to, and that practitioners and managers of practices and everybody who's involved in multidisciplinary care of cancer patients understands the nuances of immuno-oncology. It's a new field. It has new challenges. It has new promises. And ACCC identified a need for developing an institute that will focus on a number of dimensions of immuno-oncology that will allow us to transmit the information to the practices so our patients can get there. And some of the things that ICLIO will be doing will be education. We'll be launching a website, e-newsletters, e-courses online, and a live meeting which will take place in the fall for practitioners, medical oncologists, nurse practitioners, and nurses, managers of practices to understand the entire spectrum of immuno-oncology. We'll be looking at access for and reimbursement. We'll be looking at advocacy. We'll be looking at education. We'll be looking at best practices and the way that we can get these particular therapies reimbursed, conducted in the clinic, how best to deliver them. So it's a very exciting, all-encompassing initiative. We have already identified a number of scholars who are involved in ICLIO, many of whom are presenting at the ASCO meeting in 2015 and represent the leading edge experts, key opinion leaders on immuno-oncology. And the whole idea is to be a catalyst, to take the information which now exists and get our practitioners and our practices in the community using immuno-oncology as effectively as possible. And making sure that every patient who is eligible for immuno-oncology treatment has access to it and can get it in an evidence-based way.